want my first message to be from
Bentley.
You're naked, lol.
Where was the name?
Alright, is everyone ready? Sorry if I have to do this all over again. Everyone hearing the same story again? Except for Brad. This will be new to you. Alright. Oh, Tim too. You were here the first time? Yes, you were.
I was here the first time.
Yeah, you came the first
He's not
time.
important.
Yeah. No, it's fine.
Nobody noticed.
What kind of shot was it?
Alright, enough, gentlemen.
What are you talking about? D12? Dude, character. Oh,
Ready?
don't break character.
Action!
Not yet, not yet.
Oh, there it
That was
is.
perfect!
Oh.
It was fucking perfect, dude! I could be a director!
I completely blamed
God,
him.
Michael
I
Bay.
feel like I'm gonna grab this.
Okay.
Now I know how Michael Bay feels with his
Okay.
sexual...
Tim is like an extra that wants to fucking partake.
Cool it, Chavez.
A 5-year-old is taken to her pediatrician's office in order to receive her first grade immunization. Now, after about 30 minutes of begging and crying and very poor negotiating, it takes 4 nurses to hold that child down and another nurse to administer those injections. Now, not many people know better the pain and fear and anxiety that can be caused from an intramuscular injection, quite like that little girl does. About 20 years later, that same girl is here today to demonstrate the proper technique to give an intramuscular injection. Now, this procedure is a very crucial skill to many healthcare workers today, and given the right technique, it can be a near painless way for us to receive our most vital and important healthcare. I'm qualified to give you this demonstration today because I am a medical technician, and I give upwards of about 35 of these injections every day, and I have over 25,000 of them on record to date. So, first I'm going to show you the proper procedures to prepare the injection, and then I'm going to show you the proper administration of the injection itself. So, without further ado, we're going to start with the preparation of the injection. Now, for the first part of our preparation, we need to wash our hands. The World Health Organization tells us that washing our hands is the most simple way to prevent the spread of microorganisms between people. Now, I've already washed my hands before this speech began, so now I'm just sanitizing for good measure. Now, we'll need to organize all of our supplies. First, we have gauze, we have alcohol pads, we have the medicine we will be injecting, we have the syringe with the drawing needle, we have the injecting needle, and we have a glove. Now, the World Health Organization says that a glove is not a vital part of this process. However, it is good measure, especially if you're working with blood or lots of amount of patients. So, in order to prepare our injection, the first step is we are going to clean our vial with an alcohol swab. When we are done cleaning that with an alcohol swab, we are then going to take our syringe and we are going to draw air back into our syringe, and then we are going to inject this air into our vial. Now, Nurse's Guide to Practical Health tells us that we draw air into our vial because it prevents a vacuum from forming in here. Now, once we have drawn out our medicine, we are then going to recap our injection, and then we are going to change out our drawing needle for our injecting needle. Now, we must be careful we do not touch the tip of either needle, because liquid will be passing through those points and touching the patient, and we need to make sure it is all sterile. We then are going to make sure all the air is out of there. Now that our injection itself is prepped, we are going to administer the injection to the patient. Now, I will need my volunteer to come up here for me, please. And now we have 4 main injection sites, and our injection sites include the shoulder, the thigh, if you'll spin for me, please, the gluteus medius muscle, and the gluteus maximus muscle. Now, for this demonstration, we're going to be using the gluteus medius muscle. Not only is it my personal preference, but also the American Journal of Nursing put out a study that showed of all the injection sites, this one is the best, because it showed very few to 0 adverse effects in this injection site versus all the rest of them. So I'm going to have the patient declothe in that area while I put the glove on my non-dominant hand. This is the hand that's going to be touching the patient. Now, I am going to direct the patient to lean on his left hip, and a guide to clinical procedures tells us that if you inject into a tense muscle, it is more likely to bleed and cause pain to the patient. So we want to make sure it's relaxed and the patient has his weight off of that muscle. We then are going to clean the area with an alcohol swab, and we want to make sure that the alcohol is dry by the time we are injecting the patient. If the alcohol is wet and it goes into the skin, it will cause more pain to the patient, so we do want to make sure that's dry. Now I'm going to unsheath my needle, and with my opposite hand, I am going to pinch the area I'm going to be injecting. Now I pinch the area because according to my surgeon, Dr. Mahadra, that I work for, this is going to distract the nerve endings and make it less painful for the patient in the injection site. So I will hold my syringe much like I would a pencil and directly inject the needle all the way into the patient and depress my plunger until all the medicine is injected. I will then take it out, put it in the proper waste bin, and use my gauze on that injection site. Now this gauze is going to make sure that any blood or the medicine leaking back out of the injection site is being caught. Now the patient may reclose himself, and the procedure is now finished. Now to go over what we've learned today, we learned how to properly prepare a sterile injection. We have learned how to properly administer the injection, and I have shown that with the proper techniques, administering injection can be a virtually painless way to receive health care. Now, are there any questions? Yes?
How do you know which waste bin to use?
Now, if there is anything that has touched a bodily fluid of a patient, according to the Department of Health, it has to go in a proper red medical waste disposal bin. If it has a needle on it and it is considered a sharp, it must go into a red sharp container. If it is just a wrapper of any type, it goes into a regular trash bin. Any other questions? Yes?
What makes you choose a specific injection site?
Really, it's just based on personal preference. So if there are some external factors that would make me choose otherwise, for instance, if a patient had a large bruise or a large scrape, or maybe in elderly patients I come across hormone patches, those are areas I would want to avoid. Other than that, strictly preference. Any other questions? Yes?
What type of medicine did you use in the injection?
That actually was just vitamin B12. Vitamin B12 aids in the production of our red blood cells in our body, and in turn is going to help give us more energy. Any other questions? Yes?
Why use two different needles?
Because the first needle that we use, when it has been injected into the vial, it actually bends the needle quite a bit. So we never want to use that needle twice into a patient. That is going to cause a lot of pain to our patient. So we want to always make sure we have a fresh needle that has never touched anything else while we're injecting into our patient, especially to make sure it's pain-free. That concludes our speech today. Thank you.